Overseas Medical Fund il y a plus de 30 ans pour soutenir les collègues soignants et assurer un travail médical continu au Kenya, au Congo et en Haïti. Le Dr Richard Brown a été directeur médical de l'hôpital de Boulapé et a fait partie du personnel de l'IMCK. Une grande partie de sa carrière a été consacrée à la santé publique et à la prévention de maladies. Avec Judith, il a effectué un travail de pionnier dans la rédaction de la propagation du VIH-Sida dans le monde.
I want to give a brief history of the Presbyterian medical work in the Belgian Congo from the years 1906 to 1960. If you have a look at the map of Africa, you can see that the equator runs right through the upper third of the Belgian Congo. Another map shows the Congo enlarged, and you see it's divided into 4 language areas: Swahili on the east, Lingala in the upper west, Congo to the west, and Chiluba speaking area right in the center. That's where most of the Presbyterians did their medical work, and it's now called the Kasais, the territories where Chiluba is spoken. I like to look at the Presbyterian medical work in 4 different periods, about 10 to 15 years each. The first 8 years, we would say the first period, then the 5 hospitals period, then the Great Depression and World War II period, and the World War II towards independence period. So the first 8 years, from 1906 to 1914, started by Dr. Llewellyn Coppage, the first Presbyterian medical missionary in Belgian Congo. Here's a picture of Dr. Coppage. He was from North Carolina. He went to the medical school at the University of North Carolina, and 2 years after graduation came to the Congo. He did outstanding work there and was recognized by the King of Belgium as a Knight of the Order. The first 8 years, though, Dr. Coppage, arriving in 1906, had problems with malaria, and the number 1 problem of the Congo, even to this day, sleeping sickness and dysentery. He had no antibiotics, no vaccines, no sterilizers, no clinic or hospital facilities, and therefore he had to do home visits. He did what he could for the Congolese, which wasn't too much in those days. He often had to care for the missionaries and the Belgian officials since he was the only doctor in the area. The first missionary nurse, Elder Fair, arrived in 1913. She was followed by more women medical people, nurses and medical technicians. These women were either single or they were married to other Presbyterian missionaries. If we look at this picture taken early on, you'll see that Dr. Coppage is right in the center, and he grew a mustache. In front of Dr. Coppage is William Shepherd, the first missionary to the Congo, and over towards the right, second from the end, seated is Dr. William Morrison, the great linguist who put the Chiluba language into writing, wrote the first Chiluba dictionary, the first Chiluba grammar, and translated the New Testament into Chiluba. But it's interesting, if you look at this picture, how many of these were African-American missionaries. In fact, there were a larger percentage of African-American missionaries in the earlier days than they are even to this day. Many of these early missionaries were the children and grandchildren of slaves. Many of the white missionaries were the children and grandchildren of slave owners. But we look at the next part of the mission work, we would say the 5 hospital period. Now, the year 1908 is very important to the Congo because up to that time, the Congo was regarded as the Congo Free State, which really was almost the personal property of the King of Belgium, Leopold II. This was a time when rubber was starting to be used in automobile tires in Europe and in the United States. And so the King of Belgium invested heavily in getting rubber from the raw rubber trees in the forest of the Congo, but he used techniques which were brutal and terrible, and his agents were so terrible there that there was an international outcry against his agents in the Congo, and the government of Belgium took over the running of the Belgian Congo in 1908, a very important date in that story. The Belgians' new agents recognized the value of mission work. The medical personnel and the PCS missionaries support arrived. 5 hospitals were constructed and staffed, and these hospitals were strategically located. Luebo was the first hospital built, and 4 other hospitals followed. Have a look at this map. You can see that Luebo in the upper left-hand corner was at the end of the Lua River. Now one could travel from Luebo down to Leopoldville, or Kinshasa these days, by about 1,000 miles of flat water, and it was done by riverboat. But the river got too shallow, and they had some rapids at Luebo, so that was the end of the line. The Belgian authorities had an official office on the southern bank of the Lua River, and so the Presbyterian missionaries were accorded the northern bank of the Lua River at Luebo, and here was built the first hospital. Other Presbyterian hospitals, one was at Mutoto in the center of the country. Further east was a hospital at Bibanga. Then back there was Libondai was a hospital, and up to the north of the Luebo was a hospital at Bulape, which was in the Bakuba Kingdom. Now, if you were going to Luebo, you would usually take the riverboat. This is a picture of the Lapsley, which for many years transported missionaries and medicines from the capital of Leopoldville to Luebo. In the 5 hospital periods, we look at a bit at the hospital at Luebo. They were built of brick. There were hospitals and schools and churches and so on there. The next hospital was Mutoto, which actually became the largest hospital in the Kasai for some time. The hospital at Bulape was next, hospital at Libondai, and the hospital at Bibanga. During this 5 hospital period, we have pictures of 5 of the early doctors, Dr. Chapman, Smith, and Sticksrud, and in the front row, Dr. Kellersberger and Dr. Kusar. Too bad we don't have pictures of the other medical people or even of the women medical personnel, but we have what we have. The 5 hospital periods were concerned with treating malaria, leprosy, dysentery, measles, sleeping sickness, scabies, tuberculosis, and they had no antibiotics. Imagine practicing medicine without antibiotics. Surgery was for complications of childbirth, hernia, goiter, prostatism, cataracts, tumors, and cysts. Dental extractions were done by a minister. Hugh Wiles came for one term out to the Congo, and he saw the need for some dental care. He went back, and on his first furlough, he took treatment on how to extract teeth. He didn't do fillings, he didn't do any dentures or things like that, but he did extractions. And when you have a toothache, you want to get rid of it. And so Hugh Wiles was the dentist for the Kasai, and he was greatly appreciated. Then there was a training of nurses' aides. It was required by the government that you train hospital people, and every hospital went into training nurses' aides to carry on the day-to-day medical work. Next, we go to the Great Depression period. The Great Depression hurt missions worldwide. In the Congo, the medical services stalled. The Lapsley riverboat was sold in 1930. Budgets were cut, salaries were reduced, war reduced the ocean transport, supplies didn't arrive, personnel were cut and services slowed. Furloughed missionaries were kept home, and in 1942, only one doctor remained in the Kasai, and that doctor was Dr. William Rule, and we see in this picture he was holding something that looks like a liver, but I really don't think he was doing liver transplants in those days. Then we move on to World War II and to independence. There was a new vitality that emerged after the war. in the Congo and in the Kasai. The Belgian government improved their clinics and hospitals. The mission hospitals were subsidized and given medicines by the Belgian authorities. Penicillin, streptomycin, and sulfa drugs became available. Surgery improved and expanded. Dentistry flourished. Public health projects started to control tropical diseases such as sleeping sickness and yaws. During this time, the the church moved from Nuevo to Kananga. Rail and roadways were greatly improved. The schools were started both by the government and the missions. Almost every station had a school. Dr. Mark Poole at Ulave brought an airplane there and had the first airstrips in the Kasai. Medical services he extended to distant medical clinics by air. Oh, yes, here's a picture of Dr. Poole with his friends in front of his new airplane at Bulape. Over at Banga, Dr. Kellisberger pioneered studies in sleeping sickness and leprosy. He later was appointed the president of the American Leprosy Mission when he left the Congo. Here's some of his sleeping sickness patients at Banga, and here's a picture of the eminent Dr. Eugene Kellisberger at Banga. At Lubondai, there was a birthplace of the Institut Chrétien de Kasai, INCK. The classes were started to train government-certified nurse practitioners, and they had to pass the government exams. The plans were made to move IMCK to the capital of the West Kasai, and here's a picture of some of the early graduates at Lubondai. So the Presbyterian mission work in those early days was concentrated in 4 periods. The first 8 years, the 5 hospital period, the Great Depression and World War II period, and the World War II to independence period. And independence came in 1960. So what can we say about this early medical work? First of all, the early missionaries had great faith and great courage. They had few treatments for many diseases. Independence came in 1960. It was sudden and unexpected. Even so, the medical groundwork was well laid with our 5 hospitals. But the greatest legacy of the early Presbyterian medical work in the Congo was compassion for the Congolese people.
La docteure Judith Brown est une anthropologue sociale qui utilise les méthodes d'enquête et d'observation participantes pour comprendre la santé des communautés dans les pays en développement. Ses travaux ont porté sur la nutrition, le planning familial et le VIH-Sida. Pendant 20 ans au Congo, Bulape, Kananga et Kinshasa, Judith a travaillé avec les églises presbytériennes et l'Église du Christ au Congo. Elle et son mari Richard ont 2 filles, l'une née au Libéria et l'autre en Tunisie. Ils ont également vécu en Haïti, au Cameroun et au Kenya.
Let's continue the story of Presbyterian medical work in the Congo, focusing on the Kasai regions with the period 1960 to 2020. I call this new freedoms and new difficulties. First, there was a new nation. Independence from Belgium came on June 30th, 1960. It was a heady time for a few days, but then political upheaval and fighting and all kinds of troubles. 101 foreign Presbyterians left the country during that bad time, but 45 were able to return within 6 months. There was still continuing unrest for some time, but finally in 1965, General Mobutu Sese Seko seized power and was able to bring calm and stability. During his tenure, his long tenure, he renamed the river and the country and the money Zaire. He ruled the country as a military dictator, and he became extremely wealthy in the process. But he failed to foster real development. During this period, There were an estimated 440 hospitals throughout the Congo. You can see here that the government owned and operated about half of them, and the churches most of the rest. The Catholic Church, which was stronger than the Protestant Church around the country, owned even slightly more of the hospitals. The Presbyterian hospitals included these in the Kasai regions: Libanga, Bulape, Lubondai, and Luebo. The Presbyterian Church in the USA sent medical personnel and funds and supplies, always as requested by the Congolese. During this period, the Christian Medical Institute of the Kasai continued for a while to operate at Lubondai, but then it moved to Kananga City, really to a campus a ways out from the city at Chikaji. IMCK was jointly operated by three Congolese churches: the Presbyterians, the Mennonites who worked in the areas to the west, and the Methodists who worked in the areas to the east of the Presbyterians. For practical training, the students had to leave their school at Chikaji and go to the church hospitals all around the region. In 1974, the IMCK Laboratory School opened, and shortly after that, the Good Shepherd Hospital opened there at Chikaji. The hospital was followed by the hydroelectric dam, which was big enough to provide electricity not just to the hospital, but also to the school buildings, the dormitories, and the faculty homes. New health facilities in Mbujimai included the Presbyterian Health Center, which opened in 1980. And back in Kananga, IMCK renovated and opened the PAX Clinic downtown, including dental and eye services. Here's an aerial view of the city of Kananga, and beyond that big traffic circle, you can see the white buildings of the PAX. An exciting time was when the first Congolese doctors began to arrive to work in church hospitals. Dr. Nzangu came in 1976 to Chikaji and Dr. Katambwe to Bibanga, and then a few years later, Dr. Chiswaka and Dr. Chibangu. This was a period that community and preventive medicine were growing rapidly around the world, but particularly in Congo, Zaire. The Presbyterian Church in the USA sent doctors who were trained in public health, and they trained Congolese teams who began community health censuses to find out who was where and who needed the various health services. The teams began malnutrition prevention and treatment activities. They held mobile services in rural villages. The preventive services included child nutrition, family planning, and immunizations during this time. The next 20 years we're calling the collaboration or health for all period. The nation continued to be economically exploited, a great deal of poverty, not much progress for ordinary Congolese, and uprisings here and there from time to time. Due to major unrest in 1991, many donors withdrew their personnel and funds from Congo, and the medical and health zone work faltered, but then it recovered and continued with overseas help, particularly from the churches. Medical training even improved during this period, with more medical and nursing schools opening through the country and with interns training in church hospitals. A new school of public health opened in Kinshasa, and the Kasai doctors could earn the Master of Public Health degree and return to their hospitals to work with the health zones. 1980 to 2000 still was health for all, or Santé pour tous. Healthcare was extended to offer good, basic health services to even more of the Congolese people. The National Health Plan clearly defined health zones. Each zone was to have 100,000 people, and it was to be served by 10 to 20 health centers spread throughout the zone and offering prevention and cure, and one hospital for referral and surgery and training. Here's a 1985 map of the 306 health zones that existed at that time. You can see the different regions of the country on the map according to the colors, but within each region there were many smaller health zones, each containing 100,000 people. The zones were managed by the Ministry of Health, nearly half of them, then by the Catholic Church and the Protestant churches, another half, and a few by companies and NGOs. Each health zone was expected to oversee community activities throughout its area. About 10 to 20 health centers where basic care was given, and then the reference hospital where serious cases could be hospitalized, including surgery. And also the reference hospital usually had the office of the whole health zone, and it stocked the medicines and equipment for the entire health zone. So who paid for all this? Well, patients paid fees for their curative services and their medicines. The Ministry of Health and overseas partners supported the preventive activities. For example, the SANRU projects. They were funded by the United States government and helped to train and supply 100 health zones. Many were in the Kasais, such as Vibonga Health Zone, the Bulape Health Zone, the Chikashi Health Zone, and others. Meanwhile, a new disease had emerged, Ebola fever. It was first identified in Congo in 1976, and all that could be done was to try to figure out how it was spreading and to take care of people and try to keep it from going to other people at the time. Eventually, once it was understood better, educational materials were produced and used throughout the Congo as needed. Several more outbreaks occurred in Congo since then. Another new disease was HIV/AIDS. It was first identified in the United States in 1981 among homosexual men, but it soon appeared in Africa, and transmission of the disease there was mainly by sexual contact between males and females, and also the transmission could be from mother to child in utero. HIV/AIDS in the Kasais in the late 1980s saw health workers beginning AIDS teaching and testing, trying to help people to prevent being infected. In the 1990s, the hospitals saw large numbers of AIDS patients, large numbers of deaths. In the late 1990s, there were finally medicines available, but they were not available in Congo. They were far too expensive. And by the late 1990s, the nation hit some major changes. First, the rebellion that organized in the eastern side of the Congo and then moved west, with the troops walking, as you see them here, walking all the way to Kinshasa. There they deposed President Mobutu after 32 years in power. The new century began with hopes for its new presidents, but things did not continue well. Kabila, father and son, continued to rule again for 22 years. Eventually, elections brought to the presidential palace Felix Tshisekedi in 2019. What was happening in the nation? Well, the population continues to increase. There's spotty economic development, even for an increasing population. There's continuing unrest and rebellions, particularly in the mineral-rich areas of Kasai and elsewhere. And there have been, during this period, population displacements in the Kasais and elsewhere. What's happened in the Kasai health facilities? Well, there are some new technologies, solar energy, better cell phone and internet access, for example. There have been some renovations and upgrades at Moma Hospital and Lubondai Hospital and many rural health centers. The PAX Clinic in Kananga City now has a new Center for Women's Health. Training during the last 2 decades has seen family medicine residency programs for doctors, and IMCK has added university-level nursing courses in midwifery, pediatrics, and health administration. During this 20 years, the health zones continue to be coordinated by the Ministry of Health. SANRU has now become a permanent Congolese organization, helping many health zones tackle many problems, and SANRU has many donors from overseas. IMA, Interchurch Medical Assistance World Health, and others in the United States and Europe continues their support for activities in the health zones, the hospitals, both rural and urban. And 2020 has seen newer diseases continue. HIV/AIDS is no longer new, but the treatment is now affordable thanks to the United States government PEPFAR funds and other countries. But new infections continue, lots of them. Ebola fever is now in its current outbreak of the 11th in Congo. All of them so far have been outside the Kasais. And now the new disease is COVID-19. Let me close by acknowledging the book that gave us a lot of our information on the early periods from 1906 to 1980. The book is A Legacy Remembered by Sophie Crane, written and published in 1998. Thank you.
Le Dr. Jacques